Hello everyone, welcome to Talking Health with DrLaz, your favorite health program on television. From anywhere you are watching us, we're reaching you from Nigeria's capital city, Abuja. My name is DrLaz Eze. Yes, today's program, we are going to have a lot of information around sexual reproductive health and rights. But before we get to the discussion proper, the Nigerian health sector has not been having the best of times, especially since 2nd of August, when the Nigerian Association of Resident Doctors declared an indefinite strike. A couple of weeks ago, the Joint Health Sector Union, JOHESU, also arose from their meeting, gave ultimatum to the government of Nigeria, which expired some days ago. They renewed it with another 15 days ultimatum to meet certain demands, many of which are not much different from what the resident doctors are asking. So tertiary hospitals, federal medical centers, and many of them have been without the services of resident doctors, who are over 70% of the doctors working in those institutions. Something really needs to be done, and very quickly, to resolve all these problems affecting the Nigerian health sector in a sustainable manner. Can we have at least 5 years without any withdrawal or interruption of healthcare services in this country? We've had it before, we can still have it again. But everybody must play their part. All right, there are also issues on the global stage around COVID-19 and the changes in policies in the United Kingdom on who should come in and who should not come into the country based on COVID-19 vaccinations. It's entirely a separate topic on its own, and we are going to discuss it in subsequent episodes of this program. But today, interestingly, is International Safe Abortion Day. We are not going to be talking about abortion, but we'll be talking about generally sexual reproductive health and rights, what is being done in Nigeria and Africa and the world at large. I will be speaking with a key leader, I will call a global health leader, who has done so much over the years in promoting sexual reproductive health and rights in Nigeria. He's done so much for the health sector, but because our topic today is focusing mainly on what is called SRHR, we'll be having a conversation in that regard. He celebrated his 80th birthday some days ago, specifically on 23rd September 2021. He's a professor of obstetrics and gynecology for over 50 years. He is a mentor of mentors. He's many things to many people, and I'm privileged to say he's also my mentor for over 15 years. So I'll be speaking with Professor Oladapo Ladipo, the founder and president of the Association for Reproductive and Family Health. I know you can't wait to meet him. You will see him shortly after this break. But don't forget to follow us on our social media handles displayed on your screen. And we appreciate those messages you've been sending to us in the course of this program. They've been very helpful. Please keep them coming. Do stay with us. We'll be right back after this break. Good afternoon, Professor Ladipo.
Good afternoon.
Thank you, sir. It's a privilege having this conversation with you and knowing the whole lot of work you've done for health sector, not just in Nigeria, but for the whole world. And as an organization in partnership with AIT, we try to bring out solution stories, happening in the health space, success stories, despite the various challenges. And at this time, I don't think there's anyone that is in a better position, to talk about progress that have been made in the reproductive health space. Thank you for agreeing to be part of this conversation.
My pleasure.
All right, sir. So looking at the sexual reproductive health and rights, let me, just for the benefit of our viewers, read out the explanation. Sexual reproductive health and rights mean that individuals, persons, especially women and girls, have the rights or means to make informed decisions concerning their reproductive health and sexuality, free from any form of violence, coercion, or discrimination. So quickly, Prof, how may you further explain this to those who are watching?
Well, very briefly, what that definition entails is that every individual, man or woman, has the rights to decide on when to have sexual relationship, when to marry, who to marry, and who to reproduce with, and how many children they would like to have. And in general, having sexual relationship without the risk of sexually transmitted diseases.
Okay.
It is a fundamental human right to have access to sexual and reproductive health information and services. Nobody should be denied that right.
Okay, that sounds great, Prof. Meanwhile, happy 80th birthday, sir.
Thank you very much. Thank you.
In the Nigeria parlance, you say I received the blessing of longevity or,
Yes.
Old age. All right, so there's a huge problem in our sector, especially in the area of reproductive health. Nigeria ranks, I think, number 2 in terms of women dying from pregnancy-related events. Our contraceptive prevalence rate, that's those who use family planning, modern methods of family planning, according to NDHS 2018, is about 70%. It was 7% in 1990, around the period you founded the Association for Reproductive and Family Health. So what's your response? Having been in this space for a very long time, seeing this problem, what was your response and what has happened since you became very active in promoting sexual reproductive health and rights?
Well, my journey into sexual and reproductive health programming arose because of the observation that reproductive health biodata is best described in superlative. It's either the highest or the poorest or the lowest. And the fact that many women were dying unnecessarily from childbirth complication or pregnancy complications. Secondly, the observation that very young girls in the prime of their life, and even some married women who unfortunately get pregnant when they do not want it, commit illegal abortion, and many of them die. But if they do not die because they procured abortion illegally, the complication arising from infection and hemorrhage often compromise their future fertility. Infertility remains a public health concern in Nigeria, even though we're very productive in terms of human production. And then, of course, the issue of sexually transmitted infection. Those are the three things that made me to venture into sexual and reproductive health programming.
What was it why AF was founded in 1989?
This was the basis for registering AF as an NGO, local NGO. You observe that contraceptive prevalence rate was very low in the 70s and 80s. But thanks to USAID, who gave us our first grant about 87 or so, that led to a response even from government at that time. That was what led to the formulation of the population policy for unity and development.
Okay, can you speak a bit more about that government response and what value it has added to our reproductive health system?
It was observed at that time that we had a high total fertility rate, and that
which simply means we are producing too much.
It means that we're producing too many babies. In fact, they average about 5-6 million a year. Let's take, for example, at independence, population size about 56 million like United Kingdom in 1960. Today, for example, we're about 210 million people, whilst United Kingdom is just barely 68 million people.
Okay, so we are growing faster than our economy
One of the
and
successes
our resources.
of the country is human production for export, because we're exporting our greatest resource all the time. And then, of course, we have made advancement because of that government policy and that assistance from USAID in the late 80s, when we had that support from USAID and government commitment to batch spacing. In those days, we could not talk about family planning, but about batch spacing. Because in some parts of the country, they're still very conservative. Today, we have a CPR of about 17%, according to the last NDHS.
That's contraceptive prevalence rate.
Exactly, exactly. Modern methods use about 15%, which is still low.
But it's at least 10% additional from what it was in 1990.
It has shifted to double digits.
What were the things that you, apart from that population policy that Nigeria embraced, what other factors do you think accounted for this, or perhaps the efforts you've made as SOGON? You are an active member of SOGON and African Federation of Obstetrics and Gynecology.
Strong advocacy to policymakers at the federal and subnational level.
Okay.
Public enlightenment about the benefits of family planning. If we are to reduce maternal mortality, which is about 512 now per 100,000 deliveries, the lowest hanging fruit for government to adopt is family planning. Let people have access to quality family planning services. Within a short period of time, you can reduce that mortality rate by about 30%.
Okay.
But what is very important is public enlightenment about the importance of family planning. It is not population control, it is population management.
Okay.
We cannot continue to reproduce the way we are. It is a reckless reproduction, and it's because people are not informed and people don't have access to quality reproductive health services. We are still very much donor dependent in terms of provision of reproductive health commodities.
So yes, are there some gains that I know that you've led intervention for family planning, other forms of reproductive health intervention across the country and even beyond? So is there any state in the country, from your experience as the president of ARF or you were former president of the African Federation of Obstetrics and Gynecology, what impact perhaps in a state could you use as an example to encourage some other states that may still be delaying?
If you look at the mortality rates across the nation, you can see the difference between the southern region and the northern region. Education is key to development. With education, people are empowered to take advantages of opportunities available.
Right.
And I think that has been shown very clearly in the sexual and reproductive health field.
Okay, thank you, Prof. What hasn't worked? Is there a very important effort you've made over these years and you experienced failure? Do you have any example of such?
I mean, the response has been very slow in traditionally conservative states, but we are making progress. Today we can talk about family planning anywhere.
Was there a time we could not talk about it?
Oh, about 40 years ago, you couldn't talk about it in the North.
Even in the media?
You couldn't, no. They're very conservative. I mean, the religion also plays a role. And of course, the choice of family planning is influenced by the culture, religion, and peer pressure as well.
And the good thing now,
educated people now.
Absolutely, Prof. The good thing now is that a good number of champions leading family planning programs in Nigeria, even from the north. For instance, the country director of Pathfinder International that have been on our program, was very emphatic in pushing the importance of family planning. She's educated, she's female, and also So what limitations so far have you experienced in the course of pushing for, or promoting sexual reproductive health and rights? I ask this because a lot of persons in this space coming would expect, to learn some lessons from you, given the many years of experience. And how can these limitations be, taken care of going forward?
You see, again, it's because of misinformation. Every time you talk about sexual reproductive health, everybody thinks about sex and abortion. It's more than that. For example, the Child Rights Act has not been passed by all the states in Nigeria, which is most unfortunate. Even when Nigeria was the first to domesticate integrated maternal neonatal child health policy, for which we signed to internationally, not all the states domesticated it, which is unfortunate.
Even then the Violence Against Persons Prohibition Act.
Exactly. Even child marriage, which we think is most unfortunate that we're still supporting it, is part of reproductive health that we need to focus on. Why am I saying so? Early child marriage is associated with high mortality and morbidity.
Simply high number of deaths among women or reproductive age
and
group.
Injuries as well to the reproductive tract. For example, Nigeria has the monopoly of vesicovaginal fistula, which is most unfortunate.
And vesicovaginal fistula is those who are leaking urine from their
continuously
parts,
because of the damage to the bladder and even the bowel sometimes, And often these young girls are so traumatized physically, psychologically, emotionally. And the worst thing is that they are ostracized by their husband and husband's family, which is most unfortunate.
Okay, sir, I will ask for your recommendations, but we are going to take another break. When we return, you make recommendations that could help individual professionals, governments, and advocates. Do stay with us. We'll be right back shortly. Welcome back to TalkingHealthwithDrLaz, your favorite health program on television. We've been talking about the efforts to promote sexual reproductive health and rights, and my guest, Prof. Oladapo Ladipo, a global health leader that have done so much in this area, have been sharing his experience, the gains that have been made, and the limitations, that have been encountered, not just as a person, but also as a country and as a continent. So, Prof, like I mentioned before the break, we'd like to know your recommendations, in practical terms. What are the things we've made a little progress, but we need to move faster? So what are those things that we need to do going forward?
I think first of all, we need to improve health literacy among the population.
So that means creating more awareness about health.
Absolutely, and in particular, sexual and reproductive health. For example, only about 2 out of 5 pregnant mothers deliver with a skilled birth attendant. You need to increase that to about 90% before you begin to see a significant drop in maternal death. You need to ensure that those who require family planning services have access to quality family planning services when they need it. You understand what I mean? Without coercion. You need to build capacity of the health workforce to be able to provide quality services. Because we trained a lot of people from different parts of the country, this is why we are seeing the progress that we are having today, that we can talk about it with confidence, We can direct people to where they can get quality services. The policy environment is fairly good. We have a lot of policy documents.
Policies, yes.
Implementation is our problem. Implementation. And then dependence on donors. We need to generate resources internally to support sexual and reproductive health
programs.
Okay. Now, currently, the government has approved the Basic Healthcare Provision Fund. I think through that, we can divert some resources to improve access to quality reproductive health services. And it is not only family planning, like I said earlier on. Cancer of the breast, the cervix,
screening
and the
for
prostate.
cervical cancer,
Screening.
and even
Prevention
immunization
is better than cure. We need to educate the masses about the early symptoms and motivate people to change their health-seeking behavior. They need to go to the right places for diagnosis and treatment, rather than going to quacks who don't know much about these cancers. The same thing, infertility, which I told you is common. It's a public health problem.
Yes.
If you go to a gynae clinic, about 3 out of 5 clients will be complaining of reproductive failure. Likely because of pelvic infection, or they've had deliveries before post-delivery infection or post-abortal infection. You know? So we need to improve information on how to prevent these complications. And we also need to encourage people to go to the right place, to go to the gynecologist, to be specific, who can make diagnosis and provide treatment for them. Also, when we are talking about gender-based violence, which is topical now, I mean, men and women should begin to see each other as equal partners in progress.
All right. Thank you very much, Prof. We wish the conversation continues, but I'll just speak briefly with someone you've worked with over the years, Dr. Kehinde Oshinowo, who is also the interim CEO of just to give us a little bit about the impact that you and your team have made in promoting sexual reproductive health and rights. So thank you, sir, for honoring us with these highly experienced and wise words in the area of public health.
Thank you.
Thank you very much for remaining with us. We're still having this conversation, and I have another important person that have joined us. Will be speaking for us just for a couple of minutes before we round up. She's a nurse by profession, but have over 3 decades experience working in the public health space, especially in promoting sexual reproductive health and rights. Dr. Kehinde Oshinowo is the interim chief executive officer of the Association for Reproductive and Family Health, and has worked with Professor Ladipo for about 34 years. You're welcome to the program, ma.
Thank you very much. It's my pleasure being here today.
Thank you, ma. We've had extensive conversation with Prof on the impact that's been made, but as someone that worked in this space and worked closely with him all these years, what are other impacts? And when you say that quickly, especially as related to adolescent health, related issues and the sexuality and all that, we could also get your take on recommendations for young people who might want to also play more in this space.
Okay, thank you very much. I think over the years, the improvements that we have recorded in the SRH landscape has been a bit slow. But suffice to note that a lot of achievements were recorded as well. For example, we recognize very early the importance of ensuring that services get to the nooks and crannies of Nigeria. So part of what we have invested our time on was to have ensured a great deal that we build capacity of human resources both at the public facilities and non-health professionals. You are aware that in Nigeria we have a shortage of human resource capacity to be able to manage services at the facility level. Many of the people who need to get the services are poor, marginalized, live in rural communities, don't have access, and that is why we could pick along the high level of unmet need for family planning, for example. Currently we have an unmet need nationally about 19%.
Yeah.
And when you really look at those with high unmet needs, we have young people being a large chunk of that proportion. In fact, the number of unmet need among young people supersedes what we even have on a national scale. I think it's about 28% and above, depending on the demographic area where the young people are.
As I know that you, Prof, and so many others, there was this period you have peer educators, you have, is there some positive results you've got in that regard you may want to share?
Well, I want to note that we had a great deal of investment on young people, especially during the MDG era.
Okay.
A lot of resources to support young people. And so we were able to design innovative approaches. And some of those innovative approaches borders on taking information, education, and communication services to have young people build their life skills.
Okay.
Life skills is very, very important for young people. Young people can know how to say no and maintain the no. Refusal skill, negotiation skills are required by young people to be able to take appropriate decision. But above that, many young people are becoming precocious. What I mean by that, many young people are getting sexually active at their earlier years, and so they require to have services. Unfortunately, the services are not as common as what we have for the adults in all the facilities. You will always get to a facility and find adult facilities,
but not so friendly
environment for young people.
Thank you very much for joining the program today. This is a topic I'm very passionate about, and Dr. Shino talked a lot about young people, and I got involved in public health as a medical student, participating in a lot of trainings on HIV prevention, on sexual health and reproductive health. And Prof. Ladipo, interestingly, was our patron, so I'm one of those beneficiaries of some of these activities that Prof, Dr. Shinowo, and so many other persons who have been growing the skills and capacities of men, women, youth, and so many other persons in the area of health space. So as part of our solutions journalism series, talking about solutions to topical issues, I believe you enjoyed today's show. Like I promised the last time, at least once every month, we'll pick up an issue, talk about the progress that have been made, the key actors, just to encourage people, to do more, because it's not all about negative stuff. And even though it's still gloomy, but we must celebrate the little gains that have been made. So, same station, same time next week, we'll still be with you. And I thank the production team for making this possible. Do stay with us. See you next week.